few seconds just to read. In the meantime, we're going to press there with the gauze and have the patient apply pressure. And her glucose is 98. Is that good? Yes.
Okay, so that's basically what it is. Now you're gonna discard the little glucose strip on the charge container, and you're gonna, you know, remove your gloves, wash your hands, and document these values on the patient's medical record. So that's basically what it is. It's very, very simple. Once again, technology has done great things for us. We don't have to do things manually anymore. Everything is done through these small devices that we can use, and they are not even expensive. They are very affordable for the medical doctor. Oh, what am I doing here? Supposed to select the chapter and select the gradient video. Okay. So now you know how the glucose test is done. Remember, that's very simple. We're gonna wipe the first drop of blood. We are not gonna use it. I'm gonna be going over and over these things because, those are questions for exam. And when we get to phlebotomy, we're gonna do the same and you're gonna practice. So then you're not gonna forget. So reasons for errors in the glucose reading. There are many issues with errors. Remember, you have to inspect that the strips are not expired. Remember, if you collect the first drop of blood, that you can have problems with that. There are many, many situations in which you can contaminate the area by touching the area after you clean it. Remember, if you watch the video, you saw that the technician or the medical assistant or the phlebotomist, she let the finger air dry. And remember the two fingers, third and fourth finger, or the middle finger and the ring finger. So that's basically what it is. So there are many other reasons why, you might have errors is because of the machine is not working, or, you have medical conditions. So that's basically what it is. So you can read it, you can see it. This is the testing. You just get the numbers. The number was like 98, I believe. So that's normal because it's in between 70 and 110. Now the patient asks, oh, is that normal? Is that well, usually we don't tell. But many people, they just say it because it is within the range of normals. So you think that it is okay. Sometimes I refrain myself from saying it because the medical doctor is gonna tell the patient how it's it. Now, when you do, once again, this is another test that is done for diabetics, for people who has high levels of glucose. Now, this test, you are not going to do it. This test is sent to the laboratory. Once again, the reason that I mention it is because you might have it in your test. Remember, the tests are continually changing. They doing the questions this time. They remove some questions. They add new questions and so on and so forth. So this is called the glycosylated hemoglobin test. We don't call it like that. We just said hemoglobin A1C. That's basically what it is. So get familiar with hemoglobin A1C because this is a hemoglobin level, but it's done to check, to measure 3 months prior. So we do a test, and this test is going to tell us how was your glucose 3 months prior. Can you imagine technology? So now we know how your glucose levels were 3 months later. So that's basically what it is. So nothing else. So this is hemoglobin A1C or just A1C. Remember, this is a test to evaluate for, to check for diabetes, or to check, evaluate, to monitor a patient that already is diabetic, is taking medications. So let me tell you this, patients, sometimes we prescribe them with medications to be taken at this particular time, this particular dose for this particular period of time, right? So the patients don't have to come back to the office for a certain period of time unless, they get sick or something else. But after we start treating them, we ask them to return after certain periods of time. Well, we need to know whether the patient actually was taking the medication or was following the diet. Why? Because this test is going to tell us how your glucose were 3 months prior. So they're going to tell us 3 months later, not just, 3 months later was like this. No, on this day was this, on this day was this, on this day was this for a period of 3 months. So we're going to see different levels in different weeks for a period of 3 months. So if the patient says, oh, no, I've been taking my medication. Oh, no, I stopped eating or drinking or this or that contains glucose. But we're going to see the results. It says, no, it's like you weren't taking the medications. Your glucose levels are being high all this time or not. Your glucose levels are being controlled. So you're following all the recommendations that we gave you. So that's basically what it is. So if the patient is lying to us and the glucose is still high, then the patient is not following the instructions. Or the patient is mostly eating whatever we ask you not to eat or to stop or to eat moderately. So they're not doing it. So that's basically what it is. So that is A1C or hemoglobin A1C, because you will be asked about this in your national exam. So remember, this test is done for checking glucose for diabetes patient or a patient who is already diabetic, and we are monitoring the medications to see if they work or not. So they're going to give you a test that sounds or stated like this. Which one is the test done? The patient that the results are being measured 3 months prior to the test. A1C, hemoglobin A1C. So that's how it works. So pay attention to this. Very important that we know this, because these are very straightforward questions. And with straightforward questions, we know it or we don't. And it's a lot easier to get these questions right or wrong because it's straightforward. There are other questions that you have kind of, think a little more and go by the process of elimination, something like here is just it is or it's not. You know it or you don't. Okay. So conclusion. Remember, we talk about the Clinical Laboratory Improvement Amendment, which is CLIA. And what is it that this do? It regulates laboratories that, from human specimens or body fluids, so to speak, that they should be accurate, reliable, and the results should be done on time, because these tests are done right in the office, in the physician's office laboratory, or POL. Now, remember that this test can be done by anyone with not much training. That's what it's called CLIA wave test. So CLIA wave test permit the medical assistant to perform laboratory tests that provides immediate feedback to the physician. So the physician is going to have the results right away, right there in the office with the patient still there. They don't have to wait for this test to be sent to the laboratory and then wait for the results. So that's basically what it is. So the medical provider can get the results and address the condition of the patient immediately, whether getting a diagnosis directly through this test or ordering another test or referring this patient to a specialist. Remember that patients that are diabetics, we refer them to an endocrinologist. That is the specialist that deals with diabetic patients. We will talk about this when we get to phlebotomy, so I can have this because it's a question for exam. So remember, where do you refer a patient who has diabetes? To the endocrinologist, because this is the medical doctor that deals with all these metabolic conditions. So that's basically how it is. All right, so we're done for today. We're done with the chapter. See you tomorrow. Thank you for attending the class. And if you have any questions, just feel free to ask. Other than that, good night. And I will be seeing you tomorrow again. All right?
Good night.
Good night.
Good
Thank you.
night.
Take care.
Good night.
Get good rest. Night. Get good rest. Stay warm. I believe over there is hot. Cold. Here is hot. All right.